So what we'd like to do is to see whether this stress fracture is active, in other words, that it's trying to heal, or whether it's not doing anything. So we'll arrange what's called a bone scan.
Because radioactive material is injected directly into a patient, a bone scan can reveal details which would never show up on an ordinary X-ray. Seema Mohammed Targi will make up Gavin's injection. Large doses of radiation can damage body cells, so Seema has to protect herself and make sure the radioactive material stays inside her special laboratory.
Because it has to be injected into a patient, of course, it has to be sterile. And Seema's working within a sterile cell, within a clean room. You can see the rubber gloves, and they're held in position by the pressure of the air, which forces all of the dirt out of the clean environment.
The injection is made from a radioactive chemical element called technetium. It will travel through Gavin's blood to his bones. The technetium comes from a generator stored safely in the clean room. Gavin's injection is ready for collection. Technetium has a half-life of just 6 hours, so the clock has already started ticking down to the bone scan.
Right, I've just been down to the radiopharmacy to collect these doses, and in this little lead box I have a syringe which has been pre-prepared for me with the dose which we need to give to Gavin. It has a protective shield around it in the carrying box, and I'm now going to put it into a syringe shield which has a little lead glass window so that the doctor can see that there is actually some fluid in the syringe, and this shield protects her against excessive radiation since she's giving injections day after day.
Everything's ready. Daphne calls in a doctor to give the injection.
Hello, come in, Gavin. Hello, Doctor.
Hello.
Hi.
How are you?
Very well, thank you.
Daphne has explained everything to you before, I believe.
Yes, she has.
Are you allergic to anything?
No.
Any history of asthma?
No.
Could you roll up the sleeve for me, please?
Yeah, sure. I didn't notice anything. It's just like any other injection. You might feel slightly queasy having a needle stuck in you. But it didn't bother me, really.
After 2 hours, the injection had worked its way around Gavin's body. It was time for the scan.
Gavin, this is the camera that we're going to be doing the pictures on.
Yep.
I need you to lie down on the bed, feet that end, head up there, on your back.
Right.
This is the camera that's going to be taking the pictures. We've got one at the top and we've got one at the bottom, and they're going to be moving around you, taking pictures at different angles all around your body so that we can do a reconstruction in 3 dimensions. Okay?
Some of these scans were a little bit claustrophobic, particularly the one where they took a scan of my whole body. It's quite difficult to lie completely still with my arms above my head, and that was the main problem, making sure my arms didn't fall asleep. It took about 3/4 of an hour in the end.
The cameras are attached to a computer. It slowly builds up a picture as each gamma ray is detected.
What we've got here are some images of Gavin's skeleton. The skeleton has absorbed the injection that we've given him, but the area we're interested in is this area just to the left-hand side where there's an extra absorption